Hi, I'm Dr. Stacy Benson. I'm a family physician and owner of Paradigm Family Health. We're a direct primary care practice here in Dallas, Texas. So, what does that mean? Well, we're a membership based practice where we're really able to focus on our patients in all aspects of their health care. A question that I get all the time from patients, or even a confusion, is about the financing of healthcare. So, traditionally, all we think about is insurance, and insurance is how you get your healthcare, and that is it. Well, there's so many more layers. So, if you have insurance, if you're underinsured, like with a catastrophic plan, or you have like a shared health savings plan, or you're just simply uninsured, there are lots of different things that we can talk about for your care and making sure you get the care that you need. Okay. So one of the great things that we can do in our practice is we can actually sit down with you and look at what are our different options for where we can get our medications from, right? Different pharmacies have different prices. The same way you might buy your oranges from grocery store A one day and grocery store B another day. You can do the same with your medications. It's important to know that that resource is there. And I will tell you, very few doctors actually know about this, which is shocking and scary to me. Number two, what about when you need specialty care? You want to make sure that you not only have somebody that is referring to doctors that they would also send their own family members to, very important, but that they've also talked about what this could look like from a cost perspective for somebody that does have to worry about the cost perspective because they have a high deductible plan, like most of us do nowadays, or they don't have insurance or are underinsured, or are going to have to be seeking reimbursement for their plan, right? So I am proud to say that we are great at that and understand most of our specialties here in our area and have worked on negotiating cash prices for our patients for everything. And then thirdly, what about labs and imaging, right? So plenty of people will come in and they need an MRI of their knee, for example, and they've gone to the imaging center and have been told that it's going to be $2,000. And I can't tell you how many times I've heard this story, but it's going to be $2,000 with their, amazing insurance plan that they got from their employer group. But I can't pay $2,000. And if the MRI is $2,000, what's the surgery going to cost after I pay for that? Well, you could pay cash for your MRI, because you might not need surgery. You might, but you might not. And we can get that easily for example, $400 for an MRI, right? So just understanding and helping our patients be able to navigate all those different aspects of their healthcare, which are so important, right? We can do that for you. And to me, that is really what the heart of Paradigm is we don't just understand one thing. We have worked really hard to make sure we understand your health care and your well-being as a whole, whether it's supplements, whether it's medications, whether it's labs, imaging. We're here for you. Come experience the difference. Check out Paradigm. Click below.